Welcome to Cyber Bytes, your weekly dose in the latest in cybersecurity news. I'm your host, Edwin Kwan, and this week's stories highlight a familiar pattern that continues to play out across the cyber landscape. Highly sensitive data exposed through operational gaps. Nation-state actors exploiting basic weaknesses at scale, and a growing shift towards AI-driven defense that is lowering barriers on both sides of the equation. From a healthcare breach affecting clinics across Australia to state-sponsored targeting of routers and a new strain of macOS malware that locks users out of their own systems, the common thing is not about the complexity, but it's about the execution. In most cases, the initial access points are preventable, and the downstream impact is anything but minor. Let's start with the story closest to home. Partnered Health, an Australian healthcare provider operating around 60 clinics nationally, has confirmed a cyber attack impacting 21 clinics across multiple states, including New South Wales, Victoria, Queensland, Western Australia, and the ACT. Now, what makes this incident pretty serious is the nature of the data that's involved. We're not talking about basic contact details. The compromised information includes diagnostic and pathology results, consultation notes, referral letters, Medicare information, private health insurance details, and home addresses. Now, this is very sensitive medical data, the kind that carries long-term risks if exposed or misused. There are still some key unknowns here. The total number of affected patients hasn't been confirmed, and the threat actor who's responsible hasn't been publicly identified. Partnered Health has stated that there is no direct evidence that patient records have been viewed, but the data has been accessed and potentially exfiltrated. The organization became aware of the breach more than 3 weeks before notifying patients, which is likely to attract scrutiny from regulators and privacy advocates, particularly given the sensitivity of the data involved. In response, the company has reported the incident to the ACSC, the OAIC, and law enforcement. And they have also gone a step further by obtaining an interim injunction from the New South Wales Supreme Court to prevent the data from being published or used. From a security perspective, this incident reinforces a point that healthcare continues to be a high-value target, not because of any single vulnerability, but because of the richness of the data that they hold. Medical records are effectively permanent identifiers. Unlike passwords, they cannot be reset. The delay in notification is also a recurring challenge in incident response maturity, where organizations take time to validate scope and impact before communicating externally. Now, that tension between accuracy and timeliness is not new, but in sectors like healthcare, the expectation is shifting towards faster disclosure paired with clearer interim guidelines for affected individuals. All right, let's shift from healthcare to national security. Now, Australian agencies along the Five Eyes partners have issued a joint advisory warning of active targeting by Russian state-sponsored actors, specifically the GRU Unit 26165, which is also known as APT-28 or Fancy Bear. The focus here is not on sophisticated zero-day exploits or highly customized malware. Instead, the activity centers on routers and network edge devices, which attackers are exploiting known vulnerabilities and, more importantly, poor configuration practices. Now, the advisory makes it clear that the entry points are often basic. Things like default credentials that's been left unchanged, outdated firmware, and exposed management interfaces are providing attackers with persistent access into networks across government, defense, transportation, and critical infrastructure sectors. Now, once inside, these attackers are not just sitting idle. They are conducting reconnaissance, intercepting traffic, and using compromised devices as relay points to mask further operations. Now, this effectively turns the victim's infrastructure into part of the attacker's toolkit. They're living off the land. Now, what stands out here is the emphasis on small office and home office routers. These devices often fall outside formal security programs. They are rarely monitored with the same rigor as enterprise systems, and in many cases, they are end-of-life hardware that no longer receives updates. For organizations, particularly those with a distributed workforce, now this creates a blind spot. The advisory's recommendation is pretty simple. Change default credentials, disable unnecessary remote access, apply firmware updates, and replace unsupported devices. The challenge is not a technical difficulty, it is consistency and visibility across all edge devices. Now, this is one of those areas where basic hygiene, done well and done consistently, significantly reduces exposure. All right, let's go to our next story, which brings us to the ASD and their latest guidance on AI model harnesses. Now, this is an area that is starting to move from theory into operational reality. An AI model harness is essentially the orchestration layer that sits around one or more AI models. It coordinates tasks, validates outputs, and enables multiple agents to work together in a structured workflow. According to ASD, these harnesses are becoming just as important as the models themselves in determining cyber capability. One of the more important points in this update is that organizations do not need access to the most advanced frontier AI models to be effective. A well-designed harness using mid-tier models can deliver comparable outcomes in areas like vulnerability discovery and remediation. That significantly lowers the barrier to entry, particularly for smaller organizations that may not have access to premium AI capabilities. At the same time, it also lowers the barrier for attackers, which is why ASD is framing this as an adoption race rather than purely defensive advantage. The advisory points to several recent developments. Microsoft M-Dash systems coordinate over 100 specialized AI agents to identify and validate vulnerabilities, contributing to its June 2026 Patch Tuesday release, which includes 206 patches, the largest on record. Anthropic has released an open-source Defending Code reference harness along with its Glasswing initiative, while Cisco, OpenAI, and the OpenHack project have released model-agnostic frameworks designed to bring AI-assisted security workflows into broader use. OpenAI has also established a trusted access for cyber partnership with Australia, signaling increased collaboration in this space. And now on to our last story, where there is a new piece of macOS malware that takes a different approach to credential theft. Known as ClickLock and identified by Group IB researchers, this is not a quiet background info stealer. Instead, it uses a deliberate, disruptive, and coercive technique to force users' interaction. Once active, the malware repeatedly kills core macOS processors, including Finder, the Dock, Spotlight, Terminal, Activity Monitor, and major browsers every 210 milliseconds. This effectively renders the system unusable, leaving the victim staring at a password prompt. The delivery method relies on a social engineering technique known as clickfix, where users are tricked into pasting a command into terminal. If the user initially cancels the fake system's prompt, the malware installs persistent mechanisms and waits until the next login to activate its full behavior. At this point, the system becomes locked in this loop for up to 83 hours, while a secondary mechanism can continue operating for over a month, repeatedly querying the keychain for encryption keys. If the attack succeeds, the level of access gain is pretty significant. The attacker obtains the user's macOS login password, Chrome's safe storage key, which allows offline decryption of safe passwords and cookies, as well as access to browser credentials, crypto wallet files, password manager vaults, and macOS keychain. Data is exfiltrated by Telegram bots, and the malware includes a backdoor component based on the open source GSocket toolkit to establish a reverse shell without relying on traditional command and control infrastructure. Now, what makes this particularly notable is how it sidesteps some of Apple's existing protections. While macOS has introduced warnings around suspicious terminal paste activity, these prompts can be bypassed, and in many cases include options that allow the action to proceed. The hard block mechanism relies on known malware signatures, which this campaign has already avoided. At the time of the analysis, the orchestrator script had 0 detections on virus total, and the delivery mechanisms remains unclear. The group has identified at least 100 targets across 33 countries since May, with more than half in Europe, and the malware is still under active development. From a defensive standpoint, this is a reminder that user interaction remains a critical attack vector. Even on platforms that generally perceive as more secure, the combination of social engineering and aggressive system disruption is designed to push users into making a mistake under pressure. Traditional detection methods are less effective when the malware is new and behaviors are unusual, which reinforces the importance of layered controls and user awareness. Now, bringing these stories together, there is a consistent pattern. Whether it is a healthcare provider managing sensitive data, a network device sitting at the edge of an organization, or a user interacting with a terminal prompt, the initial point of compromise is often pretty straightforward. The impact, however, scales quickly. What we are seeing is a continued shift where both attackers and defenders are becoming more efficient, not necessarily more complex. The organizations that respond effectively are the ones that focuses on the fundamentals. They maintain visibility across the environment, and they adopt new capabilities like AI in a structured and deliberate way. And that's it for this week's Cyber Bytes. I'm Edwin Kwan, and I'll see you next time.